There are very few avenues in which these issues can be discussed. That speaks to the value of this particular Congress.
I guess it's all going towards making the world a better place, so to bring together all of these minds, to push forward the science, and just to progress.
I think this is a great start of what I think is going to be a very successful Congress in the future. This is a one-of-a-kind event where you get world-renowned researchers, clinical experts, people who have been involved in guidelines, clinicians as well as allied health, and even learners all coming together and talk about perioperative medicine.
I think Perioperative Care Congress really does fill a need that we hadn't identified. There was very few opportunities to get the different specialties together in one spot. Putting them together in one place is a unique feature of this meeting.
Well, I think we have to work together. I think for far too long we worked in silos, and I think the concerns and the complexities of these patients need us to communicate with each other. Coming together as a team brings these strengths to these patients and the management that they need.
I think the interaction is key, but there's a craving for new information, there's good debates, there's good discussion on questions that 2 or 3 years ago would not have been posed, and they're being brought to the forefront.
We want this conference to reflect how we see perioperative care growing in the future. It's going to be a shared model of care. We're all going to work together to deliver what we think is better care than we can do individually. And hopefully this is going to continue to grow forward.
The real beauty of this conference, I think, is seeing the multiplicity of players. You need the surgeons on board, you need anesthesiologists, you need internists.
Consensus among the different specialties and even within a specialty is incredibly hard to pull together. Differences in practice patterns, differences in health systems drive much of our care, and pulling that together is challenging. Being able to sit together and talk about it, though, makes it that much easier.
These are people who are passionate and committed, and that is quite invigorating.
They're building community for periop medicine, which is just fantastic.
Despite the fact that there's no doubt we're doing amazing things with surgery and anesthesia in today's world, we still have a reality of 1.5% of people dying, and because we do so much surgery, even though individual risk is not high, it's still a lot of people who get into serious complications and death. We can do better. If we come together as a group, we can change that and we improve outcomes.
One of the highlights of this conference has certainly been the newly published Canadian Cardiovascular Guidelines. It's meant to relook at the literature, reapproach how we've done pre-operative evaluation, management, and care, and allow people to ask questions.
If you're doing perioperative medicine, I think it's complex enough that you need to go someplace to go to a meeting. And I think if you're in Canada, this should be the go-to place for perioperative care.